I'm going to be talking a bit more about the other therapies you can use in addition to incretin therapies. Now, we know we've got a new standard with incretin therapies with combination molecules now where we're getting significant amounts of weight reduction. Now, there's always been a question as what is being lost. Is it just visceral fat? Is it other fat? And also, is it muscle mass? And that's always been the concern between 25 to 40% in some studies, the muscle mass is lost with some of these molecules. So again, that's always a concern, especially as you get older, you get more and more worried about your muscle strength and preservation. So these is new class of molecules looking at myostatin inhibitors that prevent degradation of skeletal muscle. And these are used in combination with incretin therapy. So we've got two major trials now, really Believe and Courage. So Believe is looking at something called bimagrumab, and Courage is looking at a slightly more complicated name, which is looking at tevogrumab without another molecule, garetosmab. So basically, you've got these two trials. So in the Believe trial, look at bimagrumab plus or minus semaglutide to show if there's any preservation of lean muscle mass in addition to weight loss. And there's already some preliminary data showing that actually there is benefit with bimagrumab, and even perhaps looking at brown adipose tissue as well. So there's a lot of interesting things coming in with that trial. But further building on that is also the Courage trial, which is looking at semaglutide by itself versus dual therapy with semaglutide and tevogrumab, or triple therapy with semaglutide, tevogrumab, and garetosmab, which are all two basically molecules which are looking at preservation of that muscle mass. And there's already some preliminary data showing that actually that dual and triple combination preserves between 50 to 80% of that lean muscle mass. So really exciting stuff because we're moving beyond just incretin therapy in weight loss. We're looking at what weight loss we're getting and also that muscle preservation, which has impact not just in those with type 2 diabetes or obesity, but actually if you're looking at muscle preservation, what about sarcopenia? What about long-term conditions? This is quite far-reaching effect. So I think the results of this trial will be really significant across medicine, not just ourselves in diabetes and obesity.